in the set.
You got to feel what's inside. Don't let them take you for a fool now. Don't let them take you for a ride.
Welcome to the world, young soul, where untold adventures unfold. When the moon shine and the sun glow, plant seeds and see what grows. Water your garden with wishes and dreams, free like a fish in the sea. But listen to me, not everyone listens to dreams. Some hearts are skipping a beat.
Yo, what's going on, everybody? Welcome to another episode of the Lion's Den. My name is Seth, and I'm just one of your hosts today. But what I want to get into real quick is just tell you thank you. Thank you. Right? It's Sunday. You could be anywhere, but you're here, which is super duper dope. But we love the fact that you give us an opportunity to give great information, encouragement, and different ways to connect with the community. So I want to say from me to you, and on behalf of the whole Lions Pride, thank you. Seriously, if it wasn't for you, we would not be here today. Okay? But seriously, we want to thank you. All right? I want to thank you. But without all that extra mushy stuff, we about to get our panel together, right? What's going on, Larry? How you feeling, bro?
Hey, man, what's going on? Excited about this topic?
Oh yeah. You ready for this, man? We're gonna be talking about opioids. Opioids. Yeah, it's gonna be a mess. What you think?
I am, man. I'm ready to get this insight, and get her purview of how this whole epidemic is, how it's going, where we're going, where we're heading, and what we can do to get educated on this type of stuff. Right. Absolutely, man. I'm looking very, very forward to getting this in. What's going on, everybody? So look, make sure y'all share this no matter where you are. If you're watching this on Facebook or you're watching this on YouTube, make sure you share this. And also download the Lions Pride Network on Roku and Amazon Fire TV for those of you that can't catch it, you dig live. But make sure you go and download that. We appreciate it. Herm, what's up, bro?
Man, trying to get this sharing thing right, man. You kind of
Man,
messed
we've
me
been
up a
doing this
little bit.
forever, man. What's going on? Only one button.
Hey, check it out. Like y'all, I'm excited about the show, but I gotta ask y'all a question before we start.
What up?
Did y'all see Coming to America 2?
No.
You ain't watch it?
No. Now, my own personal opinion.
What's up?
The reason why I didn't, and look, y'all can shoot me down if y'all want to. I don't care. You dig? The reason why I didn't is because it's like having a lasting memory of someone, and you it's a nostalgic feeling, and it's something that you can always go back to if you want to. I don't think Coming to America should have been a sequel. You know what I'm saying? Like, in my opinion, like a fairy tale. It was like happily ever after, not like, hey, somebody else got a baby. Do. Look, but what you think, bro?
Well, go ahead, Larry.
What you think, Larry?
Yeah, I'm one of them people. Classics is classics. Leave classics alone. I get it. It was a good feel. I kind of fell asleep on the last probably 45 minutes of it. I don't know, man. It ain't the same as the original. I'm just gonna leave it at that.
And then I read somebody say, you shouldn't be looking for the same, and your feelings get hurt.
You read that from me.
I did.
You did.
Go ahead.
So I do believe that you shouldn't be looking for the same. Now, it would have been impossible for them to make the movie anywhere near going to touch the first one. You know what I mean? I don't see how you can do that. You know what I'm saying? Especially when I noticed in the movie, Eddie Murphy and Arsenio Hall's chemistry was off. Then you could tell they ain't been friends in a while. You know what I mean? But I thought the movie was good for what it was. You know what I mean? It made me think about the first one. You know what I mean? It didn't really answer any questions to the first one, but it made me think about it. So it was pretty cool.
Hey, let's do this. Hey, the Pride, everybody that's watching right now, y'all let us know. Give us thumbs up if y'all can dig Coming to America 2 or thumbs down.
Check it. But we got this show coming up with the opioid crisis, right?
Yeah.
The only thing, because normally we get books and stuff like that from our guests to read to get pre-show. I'm a little bit upset with the doc because she ain't give me no opioids to try out before the show.
Jesus Christ.
You know what I mean? Like, where's my sample?
Shut up.
Now you're trying to put me in jail.
Hey, hold on. First of all, ladies and gentlemen, y'all give it up again for the Dr. Turner, okay? Jesus Christ. And her trying to get high on the air. Okay, that's not happening. But anyway, welcome back, ma'am. Welcome back. How are you?
Good. I did watch Coming to America
What
too.
you think?
And yeah, my husband and I, we watched it. It was all right. It was all right.
See, that's what I mean. I
It was
don't
right.
ever see.
I thought the ending was pretty good, but it was a little bit too goofy. I felt like the storyline, it was a little predictable. Yeah, so it was all right. I wouldn't go back and rewatch it how I watched Coming to America #1. Yeah. It's kind of like a one-time done.
And you know what? And this is how I feel too. Maybe it's just me, but if you watch something 30 years ago, right? And now you're watching it again, but you kind of watch people do what they was doing like 30 years ago. You're like, oh, okay. Like, you know what it is. Now, for them Thundercats that never seen it and never, got that full feeling of part one, I can dig it. They probably think it's the best thing smoking. You feel me? But me, I'm like, okay, y'all can have it. But
yeah, it was cool. Yeah.
I digress. So, ma'am, tell us about this. Oh my goodness. So we're talking about the opioid. Listen, I'm sounding silly. The opioid pandemic and how it's bringing down our community, right?
Yeah.
So, like, just give us the background of it. Why is it that it's a thing now, quote unquote, even though it's been out, but it's like a thing now to focus on?
Right. So I mean, my true opinion, I think, let's look at the history of when we look at substance use in the country, cocaine and, now look, fast forward, marijuana is legalized now. And that was a whole issue. And I really believe that right now that this is the focus of attention, and our terminology is different. It's because, yes, it has moved into the white community. And now it's an issue. Their sons and daughters, their loved ones are dying now. Now we have to do something about it, and not just incarcerate. And I think too, we look at the history of this, just putting somebody in jail, that doesn't help or solve the problem. I would say, at least locally in St. Louis, one thing that really, really stood out is that inequity, the disparity that you see between who's dying and who's still living. And, the state of Missouri received millions of money back in 2016, 2021. We still see a wide gap of our Black males dying at a higher rate. So why is that? We got funding in the state of Missouri, but why we're still seeing our Black males die at a higher rate? Either is dying or you put in jail. So now I think we have more entertainment of this because, yes, it has become a white issue too. So now let's put all these millions of dollars toward this to address it.
Mm.
So speaking on that, do you feel like the millions of dollars is also reaching out to the Black community to help the Black community with this issue as well?
In certain parts of the country. So, I mean, there are some areas in which they have some really good programs. Definitely there's a lot more work that needs to be done. Personal opinion. If we look at, St. Louis City, let's look at North City, for example. Where's the nearest place if somebody actually want to go into recovery or seek treatment? Where's the nearest place? It's about a good 15, 20, 30 minutes for you to be able to get to the nearest place to want to seek treatment. We only have one methadone clinic. So I think there's so many systemic issues that we need to discuss. And then there was a study that came out. So out of all of the treatment centers and places that receive grant funds, what they showed was that our Black men, so let's say we got them into care, they dropped out at all different phases of care. So when they did an assessment at 1 month, at 6 months and a year, they were showing that Black men, something happened and took place. They didn't remain in care compared to white people. So to me, what does that say? Some people have really strict discharge policies. You mean to tell me, that because somebody have something in their system, now you completely kick them out the whole entire program? Like me, that's my biggest pet peeve. I don't think we need to be kicking people out who's trying to come for help. And I typically see that sometimes there's no mercy for some people. So it's a lot of issues I think that need to be worked out. I think overall, I think we're making some great momentum now because, a lot of those disparities were talked about. Now we're getting more funds to address this and talk about the issues specifically in St. Louis City and St. Louis County.
Hey, Doc, and staying on this topic, I know that since 2016, according to the Human Health Services website, they spent $9 billion, or they've invested $9 billion into these treatment facilities all across America.
Yeah.
Can you, can you explain a little bit or talk about what this treatment consists of? Because I know we hear about it, but what is this
Oh,
treatment?
that's a good one. Yes, let's talk about treatment because it's different. So that's
Mm-hmm.
why I get excited about it. So I would say this one thing in the medical community, and we've always known this, it's just now is really coming out. Substance use disorders, it's a chronic disease. So that's the way we're educating people now. You know, new doctors that's coming up. That's where we're really putting that message out. You treat this as a chronic disease. So the same way I treat somebody for diabetes or hypertension, that's the same way we want to start addressing substance use disorders. So how it used to be back in the day, of course, methadone was the one that everybody heard about. So there's a lot of stigma related to methadone. It's actually still a great treatment choice for some people. It definitely can still work well. But we used to start medications as a last resort. Now in the state of Missouri, we implemented something. It's a low threshold model to start Suboxone or Subutex. So instead of going through all these lengthy assessments, you know, you try to do it detox style, don't use anything. What we know in the literature that if somebody actually we start, you know, Suboxone or methadone, it actually helps to stabilize their withdrawals and even stabilize the cravings. And what I like to tell people about that, the reason why we look at this as a chronic disease is because if somebody's actively using, what happens, you know, people are using so they don't feel dope sick. So that's why the cravings is driving it, the withdrawal symptoms, that's what's driving it. So what medications do, it helps to stabilize that. It also works to help your brain heal. So you put somebody who's withdrawing, you want them to go through 15 different screening tests. A, that person may not even come back. Two, they're not going to be in a mental state to be able to answer all these questions, do all of these, jump through these loopholes. So what we find out, if we start people on medications at the beginning, then we allow time for their brain to heal. We address their cravings, decrease that or even eliminate it. Then we also decrease or eliminate their withdrawal symptoms. So for me, a lot of advocacy about, okay, we're going to approach this the same way we do with other chronic diseases so we can save lives. So that's something completely different. I don't like the word detox. I feel like it's another stigmatizing word. I need to go detox. No, you don't. And another thing too that's really exciting, you don't have to be shipped away. People always look at treatment. I have to go away for 30 to 45 days. I got to detox. No, you can actually start a primary care clinic, a treatment center. You can do outpatient treatment. You don't have to use that model of being sent away for 30 or 45 days. You can still stay in the comfort of your home with your loved ones to start treatment.
You know what? That's interesting because I would think that those individuals that want to get away, they want to get away from the temptation. They want to get away from that environment because sometimes it's those individuals that they're related to that's giving them the stuff, you know what I'm talking about? But look,
and it could be, I mean, some people that may work for some people, you know, I just have to get the message out. That's not the only way, you know, for some people, they want that, but a lot of people are not even aware of the change in treatment on the medical side. How do we approach that now?
No, that makes sense. That makes sense. Hey, ladies and gentlemen, y'all chime in, right? And Foots, good looking out, brother. Listen, everybody, if y'all watching this, let us know where you are. Let us know that this word is getting out to you, right? We really, really do appreciate it. But we got to take a little pause for the calls like we normally do around this time. Ladies and gentlemen, we have to give a special shout out to Miss Tracy Brown, okay? Here it is. Is your credit jacked up? If it is, this is who you need to call. Give Tracy Brown a call, right? As a financial literacy coach and credit repair specialist, Tracy Brown teaches people the importance of personal finance and help them identify and dispute negative items on their credit reports. All right. Her services allows individuals to leverage the Fair Credit Reporting Act to improve their overall credit score and credit history to position themselves for home ownership, lower interest rates, entrepreneurship, and generational wealth. So if you need some help, stop talking to people that credit is worse than you. Them folks trying to tell you what to do. Talk to a professional. Give Tracy a call. Her number is 618-560-3687. One more time. Tracy Brown, 618-560-3687. All right. Give her a call now. But anyway, back to you, ma'am. So, yeah, I mean, I can dig it, you know, but I think that it's important. I think it's important that individuals know that the help is out there. But no, we just appreciate, you being on here and doing what you're doing and getting this word out. All right.
Thank you.
Doc, question for you. For those that didn't listen to you last time we was on here, because we didn't really, what is your background when it comes to opioids, just so people know who they're dealing with right now?
Right. So, really interesting. So I'm family medicine trained, and a lot of this wasn't even incorporated into my initial, like going to medical school. I got a little bit exposure in residency. It was really one patient, one of my faculty or attending doctors who. A lady got admitted to the hospital. She was in active withdrawal. He took out time with me one on one to help me to understand the physiology behind substance use, and then how a lot of times we as medical professionals, we stigmatize people for that. And once I saw that this was something that was treatable, chronic disease, that's what got my attention. So I'm family medicine. I actually deliver babies. I take care of moms with substance use, mom without substance use. I take care of, the entire family. So I take like the old school doctor. But I really got passionate about this. The more I learned about this, especially the impact on the Black community and even how I grew up, how I had uncles who doing stuff, I go to grandma's house, see stuff in the backyard, and I was even like grew up in a way that I was stigmatized or biased behind somebody who's actively using drugs. And when I learned about the history, how it was rooted in racism, the differences, it's just kind of like somebody needs to start talking about this, and with my practice, when I started to incorporate that part into my practice. And when I say substance use, not just opioids, but, methamphetamine, cocaine use, cigarette use, alcohol use, those are treatable conditions. And a lot of people don't even know that treatment options could be available. So for me, that's where my passion came from. And it was exciting to be able to talk to people about that and to provide that whole holistic, care. I can take care of the hypertension, diabetes. By the way, you want to quit smoking, we can do that too.
Okay.
Yeah. I think, Doc, while we're talking about the opioids, let's get into some terminology, right? So we talked about that there's a difference behind scenes of opioids and opioid. And then I also want you to hit on the difference between the addiction, tolerance, dependence, like how they're all not the same, but sometimes we use them interchangeably.
Right. And people do use all those interchangeably. So an opiate is just an opioid in its natural form. So heroin or morphine, codeine. Opioids is an all-encompassing word that also include your semi-synthetics as well as your synthetics. So your synthetic or man-made opioids, that's your fentanyl. That's a man-made one. Your semi-synthetic, that's like Norco. So it's a different scope of different opioids you deal with. You do have oxycodone, prescription pain medicines. That's also a man-made type opioid. So that's the difference with that. And you may hear people say opioid in general, and it tends to include opiates as well. Now, when you talk about addiction, not everybody who uses an opioid is addicted. And when I mean that, not everybody that's prescribed Norco or Tramadol mean that you're addicted to that particular prescription pain medicine. So an addiction come about is when you have an uncontrollable desire to continually use, even despite negative consequences. So it's a set definition that they have to describe addiction, and not everybody fit that. So that's why I said when some people are given a short course of opioids, that doesn't mean you're going to become addicted to that. It does not say that at all. You have to have those other things that go into that uncontrollable desire despite negative consequences to use. For a lot of people, having withdrawal symptoms. So if you've ever seen somebody withdraw from heroin, I mean, it's pretty intense. I tell people it's almost kind of like, a really bad stomach bug. They have stomach cramps, diarrhea, skin flushing, blood pressure will go up, goosebumps, really, really uncomfortable anxiety. They'll use a little bit more and it'll take those symptoms away. So that's addiction. Now, when you want to talk about dependency, that's not the same thing as addiction either. So dependency is more so your body physically, there's some alterations going on just with the receptors in your body, meaning that you're, constantly using some, but you're not using to the point it's uncontrollable. You're having negative consequences. So that's the main difference between those two. Believe it or not, I actually don't really use the terms chemical dependency anymore. A lot of our terminology changed. So I'll say substance use disorder, opioid use disorder, methamphetamine use disorder. So that's alcohol use disorder. So that's what we're using on the medical side, because believe it or not, those are all stigmatizing terms too. Addiction is fine too, but it's addiction medicine. I say that.
Wow. Listen, ladies and gentlemen, I don't know if y'all getting this good old-fashioned education, but I swear I did not know. I just thought that if you was addicted, that's it. You know what I mean? If you can't put it down, you got the problem. Now you dependent and all that. It's a mess. It is totally a mess, but this is some great information. So I guess And like, what would you say to individuals that, and coming from my position, and even individuals that's watching now that have military backgrounds, we have so many situations, physical situations that cause us to receive pain medicine outside of vitamin M, the Motrin, right? Because you can get in a car accident, lose an arm, they give you Motrin. But sometimes they will prescribe, controlled substance to help ease the pain, even for a what is it, the wisdom tooth, right?
Right.
They load you up with that. So how often do you see individuals or hear of individuals in the military that become addicted or become codependent on that?
Right, with those. I mean, I don't take care of too many patients, people in the military. I guess I can speak to that from one different standpoint. So right now, we were talking before the show. There was 3 different waves when it came to this opioid epidemic. In the early 2000s, maybe like late 2000s is when you really saw more prescription pain medicine overdoses. Right around that time too, when we had laws that were implemented, like the PDMP, the Prescription Drug Monitoring Database, you had DEA, tracking doctors who were overprescribing, and a lot of the prescribing limits and hesitations. And so people, and doctors immediately cut people off of chronic opioids. And so the next thing, people went to heroin. So right around 2013, 14, 15, you see a rise in heroin use in a community. Well, people then built a tolerance with that. So then fentanyl came on the scene around 2015, 2016. Fentanyl is way, way more potent. But for some people, they think that if it's more potent, I can get a higher high. And that's actually not the case. But people think that when you talk about that. So I would say right now, fast forward, this issue that we have now is predominantly fentanyl that's accounting for the overdose deaths. If you would have asked me that question back early 2000s, I'll be talking more about prescribing habits and things like that. So fast forward, it's more so what we're seeing on the streets. You're not really seeing too many people overdose and die from chronic prescription opioids right now. And it has to do too, a lot of us are more educated on it, and I must say there were doctors that were overprescribing, yes. But interestingly, if you really look at the data with that, when we talk about racism in medicine, Blacks were actually less likely to be prescribed an opioid. So take this back. So a lot of times our chronic pain was underestimated. So we'll get the Tylenol, the ibuprofen, even if an opioid was indicated. So there are times where an opioid is indicated. But if you look at the data that what we see, Blacks' pain, our pain was underestimated. There's this false sense that because our skin may be tougher, this comes from the slavery mindset. Plenty of studies that came out that looked at when it came to somebody who was Black, in which it was an indication to get an opioid, less likely to receive it. So our pain, or we were more likely to be accused of drug seeking. So unfortunately, when you look at that picture, we have a mess here. So it was a study that came out. It's actually a paper that came out from the New York Times. It caused a lot of mess because they tried to say to the New York Times, or I shouldn't even drop names like that. It was a paper that came out. They tried to say that Blacks were protected from the opioid epidemic because of that. So it was so much rebuttal that came from Black physicians, Black scientists, because no, you cannot say we were protected from the opioid epidemic when we were less likely to get our pain treated, less likely, we're more likely to be accused of drug seeking. So it's a whole thing that came out. They went back, they took that paper back. So look at it like that as well. Like that's what I say, it's a mess when you really look at the heart of this. And that's why for me, I feel like it's my goal to educate and teach, because people don't know. You wouldn't know if y'all went to the emergency department and the doctor just told you, no, I'm not going to give you that. And it may be indicated. You may have broke your arm and indicated for you to get a short course of opioids, and they'll tell you, no, you don't need it. Tylenol, ibuprofen, that's fine. And you go home with pain thinking, well, the doctor told me that. No, it's pretty messed up.
Don't tell me this. Don't tell me that.
Bro.
Tell me that. Yeah. Did it hit you too?
I mean, imagine they tell you we kept you safe by letting you suffer through some real pain.
And then going back, my mind just said, I wonder, does it come from how they viewed us? But the fact that you said it just pissed me off that much more.
The way that she talked about drug seeking, I'm no medical professional, but
right.
I feel like that's probably the majority of it, they think that black people coming there is looking to get high.
Just looking to
You
get
know what
high.
I'm saying?
Like, oh,
Yeah. I got a bullet wound in my shoulder, but
Right, just get some
bump
ibuprofen.
that.
Yeah. So there's a lot that goes into that. Before we was talking about the differences with the cocaine epidemic in the early 90s and the differences now. And I gave the example, when our black moms had their babies, it was crack cocaine babies or the mothers were crackheads. Fast forward, now we're seeing substance use disorder, neonatal abstinence syndrome. We have nice medical terms for this, but if you actually look at it too, look at how the media portrayed it. That's another big topic. The media portrayed, you saw crack tubes, you saw, blacks in communities that was, poverty stricken, ran down, dirty. Our perception of substance use was actually narrated and shaped by the media. Let's fast forward to the early 2015, 2016. What did we see? We saw the young white guy in the suburbs who was on opioids. Everyone felt sorry for them. Completely different. The narrative changed. If you look at that, compare those two, the narrative completely changed, and the media actually helped to shape that. Now we're seeing babies with neonatal abstinence syndrome. This is what we need to do. Give them. And it's true. If they start withdrawing, we give them morphine in the NICU. We monitor them. But back then, it was separated moms and babies. You didn't get that second chance. You were a bad mom. It was pretty intense. But the media played a really, really bad role in how they portrayed substance use in the Black community and how it's being portrayed now when it comes to opioid use in the Black and the white communities.
A Minister of Society was really my introduction to that. That portrayal is when old boy said what he said to get crack.
No. What about when New Jack City? You remember when?
Chris Brown
was like, Nino Brown was like, man, crack. And then you saw where everybody stayed at, and then you start pumping it, and then you know what?
And that's how we portrayed ourselves with crack, man. You know what I'm saying?
Yep.
Like,
I'm not feeling this, y'all. I'm not feeling this topic. No, don't get me wrong. I love it, but it hurts though.
It does.
Because we help do this to ourselves.
Damn, man.
It does. It does. But you know what? I wouldn't say we did it to ourselves. I would say.
I get what you're saying.
This came from with the majority what they thought. So even if you go back to Nixon when they did this war on drug stuff, all of that was rooted in racism. That's where a lot of this stuff started. It was a comment one of his closest advisors said that that we're going to purposely place this into their communities. Like, come on, that started on a larger level. And you had the media portraying this. We were watching TV, majority of people. So that's what we saw. Those are the images that we saw. We fed ourselves. We talked to our kids like that. So it came from things that was out of our control. This is what we were exposed to. And this is what we were made to believe that, disregard there. Even the Just Say No campaign. That's horrible. Yeah. When we went through the DARE program, like, do you actually remember anything you learned from DARE?
I just remember the cop that came to the school.
That's
all you remember.
Know what I'm talking about? You remember that, and then and the egg. You know what I'm talking about?
DARE program.
Yeah, this is your brain on drug. Yeah.
Hey, hold on, y'all. Look, we gotta take a minute. Damn, man. Yo, I wasn't expecting all this because what it does is
we should have, because when we had it the last couple weeks ago, it brought the pain. Come on.
I know, but what I'm saying is that it just kind of open up old shit. No, you know what I'm talking about? Because you think about your childhood, you're like, yo, my uncle or my aunt could have got this help, but they saw it as a way to control.
Look how we looked at him. Yeah.
You saw.
Look how we looked at him.
Yo,
we looked at him as a problem. Yeah.
That's a problem.
Yep. And it was lock them up. And if we look now, but even just look at for those Black men or women who are incarcerated because of marijuana use. Now fast forward, we're legalizing this and
selling it in brownies. It's in brownies and cookies now.
Yep. You got people profiting stocks on this stuff. Like, come on, like it was actually a video. I have to send it to y'all afterwards that I follow. I like the Drug Policy Alliance. They're like a great organization who advocate for this. Their director, Dr. Cassandra, I don't think she's a doctor, no, it's Cassandra, I forget her name, but she's amazing if you heard her talk. But they have a short video by Jay-Z in which he's talking exactly about this issue with marijuana use, how before, you want to incarcerate us, talk about us, but now since in the stock market, now it's making money. Like, it's a great little video, 3-minute little video he put together.
So look, this is the deal. And I love Jay-Z. Don't get me wrong. I really do. But let's be 100 Let's be 100. You know what? Look, we gonna come back, y'all. Look, because I'll take it off the deep end, but yo, ladies and gentlemen, please stick around. We got to take a pause for the cause, y'all. We're talking about the opioid pandemic and what this is doing to our community and ultimately, essentially, our culture. Okay, so y'all don't go nowhere. This is a great conversation. Take time to share this, right? Take time to share this and tap a neighbor and say, neighbor, check out the Lions Den. Right on. We will be right back. Monique Slater is a top negotiating, award-winning real estate agent in San Antonio, Texas. Her focus is on educating and empowering individuals on building generational wealth through home ownership while providing exceptional service with integrity and excellence. Although her heart is for serving first-time home owners and the military community, her clientele ranges from $100,000 to $2.5 million. Monique has developed an awesome team that can get individuals into a home. Mention you heard this ad on the Lions Den with Seth and get a $500 rebate from Monique at closing. After servicing in the Air Force for over 28 years, retired Chief Slater has a massive network so she can connect you with an awesome agent anywhere in the U.S., and your referral will get a special gift card from Monique. If you're in the San Antonio area or relocating there, give Monique a call first to help you find your dream home. Her number is 210-237-7268. One thing we can cherish during these times is family dinners. Think about it, the nice, succulent southern fried chicken, baked beans cooked to perfection, creamy macaroni and cheese, cornbread. You get the point. Come check out Kevlar's Grill, where all the meals are cooked with perfection, professionalism, and love. Located outside the Scott Air Force Base back gate inside the VFW is where you can find them. Also, they have military discount for all of our serving members. Give them a call. Their number is 618-416-5700, and that's inside Scott VFW, post 4183. And they also have Grubhub. Call them now and tell them that the Lions Den sent you. Hey, what's going on, everybody? What's going on? Welcome back. Y'all. We're talking about the opioid pandemic, and we got the doctor on, Dr. Turner. Hey, welcome back, man. Welcome back. And so, look, before we went to the break, we talked a little bit about entertainers talking about the issues with the pandemic, and the doctor brought up the Jay-Z, and I love Jay-Z, don't get me wrong, I really do, but I do understand that in the 80s he was part of that, you dig? So I mean, he made a profit too, let's be real with it. And then you got individuals right now that still celebrate that same thing, so I don't know. I feel a way about that, but I get it. And I'm older now. You know what I'm saying? When you got kids and you looking at things, you got a job, you got a career, you're like, yo, get out of here, crackhead, or get out of here selling that mess in my community. This is my community now. This ain't my hood. So, but I get it. But go ahead, Larry, man, you got it, bro.
Yes, Doctor. Just talking about this from our culture. In the 90s, it was all about pushing the drug and the hip hop culture, right? And then now you fast forward 25, 30 years, now it's about using the drug. It's almost like it became popular to be a drug addict or a drug user. I don't want to say addict, but a drug user. Can you expand upon this whole lean thing, this culture, this codeine drinking? Are you familiar with that? And can you educate what that stuff is and what, is that part of the opioid crisis?
Yeah. So you mean like when people using like the liquid codeine to get, to try to get high?
Lean.
Codeine drink.
Yeah. I think that's all under the umbrella, of active substance use. So, so I would say this, like one thing, I'm a part of a group of us that we're doing some things regarding harm reduction. It's a different perspective. And we were talking about this before. So when it comes to somebody actively using drugs, the narrative have been, that's a dirty person, they're a thief, don't deal with them, or, they don't care about themselves. And that's actually not the case. The more and more I do this work and I actually, form relationships and talk to people and know people. That's not it. Some people are using just because they want to. They don't want to go into that drug sickness. So how can we keep those people alive too? Even before, when I used to tell people that, addressing substance use in the Black community is always going to look different. It's not going to have the same approach and look the same way as we address it in the white community. So if our goal is to keep people alive and to keep them from dying, then how can we do that? And so for me, I've learned, I'll be honest, I've learned to embrace somebody who's actively using drugs. So some things, I don't let my patients call themselves addicts. I'll talk to them like, that's a stigmatizing word. It makes you think that you are the problem, and you're not the problem. It's not you. This is a chronic disease. If you came and saw me in the office and you had diabetes, I wouldn't throw you under the bus because of, you chose all the many years to eat unhealthy and it's your fault. That's not how we address it in medicine. I connect you to the care. We start insulin if we have to. We talk about eating healthy. We do that. And then in my opinion, somebody who have a relapse will say, if you have diabetes right around Thanksgiving and Christmas time, we don't kick people out because they have a relapse of unhealthy eating. So why would you kick somebody out because they have a relapse of actively using when it's a chronic disease? So it's changing that narrative, changing how does that look? And if you can be more accepting, because believe it or not, people who actively use, even within our own culture, we've learned to stigmatize them, push them to the side. They know good. Why? Why is that? Why do we have to treat somebody like that? And that's another part that I want to change, because they do care about themselves.
So I'm going back to what you kind of alluded to. What do you think is the biggest difference between how the white community treats drug users as opposed to the Black community? What is the biggest difference in the responses?
So the biggest difference, that's definitely a loaded question. I think my biggest thing, I think, is how the media portrayed it. We talked about that earlier. I think that's one of the biggest things, that now it's a white issue. We did a completely revamping. It was, we need to put this into medical education. We need to not say these certain words. We need to revisit our policies. And so I do think that once it became a predominantly white problem, then you started seeing people that wanted to change it. Once you started having, executive sons and daughters with this too. Now we need to change this. We need to do something differently about it. And I think that's why we're seeing this difference right now. Now, I will say across the country, still in some predominantly Black neighborhoods, you're still seeing a higher overdose death rate. There are things now about, I don't know how you all feel about this, but some places have safe use centers. Believe it or not, they have syringe exchange. So we can talk about that as well. And people get so concerned when you talk about syringe exchange. Oh, that's enabling drug use. Like, no, it's not. I don't like that word, enabling. If you look at the data with those places that do syringe exchange or that safe use, nobody has overdosed and died with any of that. They actually connect people to care and treatment way more frequently than just a regular old somebody trying to find treatment. So there are some positive things behind it. And the thing is, how do you safely teach somebody how to use? So at a safe use center, if a lot of places over country, they have those, somebody will come in, they can actively use, it's monitored. You have nurses there, they'll bring their own stuff, they'll use. If something happened with an overdose, you got immediate help right there at the scene. So it's a little bit different, but it's different for us because we still stigmatize substance use. With syringe exchange, we have a location here in St. Louis. People get really concerned that that's going to bring a negative crowd, or you're going to find people using behind there. No, actually, people really respect the place. They come in, they turn in their old needles, they get new ones, and it also cuts down on spreading of HIV, spreading of hepatitis C, hepatitis B. You have to think about those transmittable diseases as well that comes from people sharing things like that. So if you coming in doing a syringe exchange while you're there, here, why don't you get some food? Are you interested in treatment? If you're not, okay, here are some options whenever you are. So those places have actually connected people to care by using a harm reduction model and meeting people where they are.
With or without, they're going to use anyway.
Yeah. Mm-hmm. No, and I can dig that. And that makes sense. They're going to do that. You're right. Yeah. And I think my issue is we have lost so many families to crack, right? So many families are broken apart, so many families. And like there's someone in there right now from probably this much of crack for 30 years. You dig? Yep. So I feel almost slighted. Like, yo, now you're trying to help folks out. Now you want to give them a safe place. What was that safe place? You dig? So I feel, and no shade towards individuals that you know they have these heroin like phone booths, you dig, where they can just go and, you know, boom, get it in, nod off, and go about their business. But where was that same energy? That's all. You know what I mean? And maybe
I agree.
I'm the only one to feel that way.
No, that's
really,
you're completely right. When I first learned about this, those were the same feelings I had. Like, really? You know, back then, like, I had no idea about that. No, I agree with you. Those are very valid and appropriate and real feelings to have when it comes to this. Nope, I agree with you. Definitely agree.
The only way
There's
to
a place
fix that,
actually in Illinois. They have I was on a conference call. They actually give out I think they call them drug kits or like safe use kits. It's something like that. And they actually have like a pipe in there. It has the, you know, all the paraphernalia you need, has the alcohol swabs, and they did a presentation on them having that available to, and it was just predominantly Black community they're serving, and they saved lives. So the overdose death rate actually went down. They were able to connect people to treatment. So they use one thing, and then they also decreased rates of HIV and hepatitis C as well. So, but I agree with you. Thinking about that, why wasn't that those are options back then? The only options back then were either, well, pretty much being put in jail, you know, or being forced into treatment. Yeah.
So go ahead, Herm.
I feel like the only way, like what Camille was saying, how did we do it? I mean, you got to go back now that we see things in a different light. Go back and look at them people with drug charges and see how you can help them. You know what I'm saying? If they're able to get out of prison.
Right. So, you know, that's what I'm saying. Do something like that. Yeah, you see what I'm saying? If we're now seeing this as
they didn't kill nobody or something, you know what I mean?
Right. And if we're seeing this as a disease, wasn't that a disease too? That's all I'm saying. So, like, there's individuals that's still alive right now that, you know, from the 80s that was tripping, you dig, that can come on out. That's all I'm saying. Like, where's that same energy? But
yep. I don't know. Yeah. I mean, even the difference, you know, when we talk about the crack cocaine, the rock compared to the powder, you know, the sentencing was different. The rock, of course, 25, 30 years or longer for a little bit of a rock compared to cocaine. I think it was like 100 grams compared to like 5. And the cocaine powder, 5 years sentencing compared to if you caught with a rock, you get 25 to 30 years. And the rock was predominantly found in Black communities. So even with that, how the law was set up, if you were caught with rock, you automatically sentenced to 25 years. But somebody can have the same, this is the thing I trip off of. No matter how you do it, crack cocaine or, you know, the powder or the rock, the same amount, the substance. The only thing was different. One was powder, one was rock. And the people who choose to do the rock, you had a risk of going to jail for 25 to 30 years. But if you use the powder, it's only 5 years. And the powder was predominantly found in rich white neighborhoods. But just think about how that law was made. I mean, that was back in the 80s.
Yep.
That's because them lawmakers was on that powder. You know what I'm saying?
It was. Yeah. They was on that powder, and then look, they could afford it. You did, but yeah.
Hey, Dr. Turner, sticking with this safe house or safe whatever. For where they can use. So is this place designed for, like, are they bringing their own drugs to this place, or are they being supplied these drugs?
No, they're bringing their own drugs. Yeah, you bring your own drugs. Yeah.
And the reason I ask this is because I understand, you know, having them a place to do it where they're not out in the streets and out, you know, somewhere where people can see it. But the other side of this is the folks that are addicted or hooked on this stuff, they're committing some really horrendous crimes to get their next fix. And I think that's where the stereotype and the stigma comes into place, is when you see an addict, it's like, oh man, look out for this dude or this gal, because it's no telling what they're going to do to get that next fix, which could include taking your life.
Yeah. I mean, and I mean that I have to acknowledge that with that life, that there is some criminal part with it. You know, I can't completely discredit it. But I can also say you have some people who, you know, they'll get their $5-10 and, you know, go and not do anything of violent crime in that nature. But with how those places are set up, you have to bring your own drugs, your own supply in. Yeah. So I mean, I can't really.
Are they educating them? Like I get it. You come in, you do your thing, you go through the motions. Hopefully, you wear it off, and then you go about your business. But is there some other educational purposes while they're using it?
They do. So it's not just So I was saying a lot of those places when they're set up, They still have educational. If they want to, they have access to, if they want to go into a treatment center or start on treatment, that's definitely made available. So it's not just, if someone comes in, they want to actively use, that's available, but then they also have additional resources or things available as well for people. That's how they're able to connect people to care if they decide to say, hey, you know what, I think I want to go ahead and go into treatment. Those locations are able to, they're able to do that.
And so we got a question down there saying, shout out to you, Miss Lily Wilson.
Safe use.
Yeah, so how are they funded?
Yeah, so they're not houses. So these are actually, and believe it or not, these are actually not, they may have some low key in the United States. Most of these are actually in other countries. So if you look at other countries, the United States, we have the highest overdose death rate. A lot of other countries have models just like this. And it's actually funded through their government or through independent agencies. So it's not, in the United States, you won't find anything, I should say, that's exactly like this, but it's a large building. It's not like it's a house. It's set up where you have stations, you have nurses there. It's a whole system. So you walking in, it's not like it's just, a house, you go up to the corner. No, it's a whole thing. You would check in. It's a whole thing set up with that.
So it's just not a nice crack.
It's not just right. It's not right. It's not no, it's an actual facility. It's an actual facility. It's an actual whole facility. You come in, they got a little separate place. It's nothing how you're thinking, like, house, like a drug house.
Wow, that's it.
Right. It's nothing like that. Yeah, nothing like that. But it's different. I don't think, the country will ever get to maybe that point. But if you look at other countries and what they're doing, I mean, other countries are making leeway in this area, and their people are not dying. Yeah.
Man. Yo, first shout out to Bill, man. He's dropping some real good information in the chat. Shout out to you, brother. But back to this safe house, right? What it sounds like to me is almost like the church model. You know what I'm saying? Just get the sinner through the door, and we're going to do the rest. You know what I'm saying? Because you're saying, because they got people in there that's going to talk to them about, hey, are you ready to quit? You know what I'm saying? We're just trying to get you in the door.
Listen, look, first of all, hold on, wait. Look, I'm gonna say it. The reason why he's using this analogy, because this is the first time him going to church since the 80s anyway.
Bro, you talking about today? Today, man, I went to pray, my hands got numb. I was like, is this how we do it? I'm like this.
They started to turn.
Yeah, man. Hey, I gotta get it. I gotta get accustomed to new things when you got a woman, man, that goes to church, man. I gotta be at church.
That's good. That's really good.
Now I'm in church over there trying to pray.
Look at him, y'all. Listen, look, he collared shirts, not going to church. Hey, won't he do it?
So I found, I went to the safe house. You know what I mean? I came in the door and but it's what it sounds like.
So the actual, I say, safe consumption sites. That's
safe consumption site.
Right. Safe consumption sites.
/ drug church.
Houses.
/ trap house.
But you can actually Google it. If you want to learn more about it, you can Google it.
Absolutely.
And see that it's positive. And the other thing too, when we y'all know about Narcan, y'all familiar with that? What that is? Narcan. Oh, we gotta talk about Narcan. So Narcan.
Is that the stuff that people can smell, or they huffing, they smelling, they sniff the cans?
But no, it's not a can. It's this.
You a square, dude.
I'm a lame. Hey, I don't do it no more.
Narcan. So I'm glad we're talking about this. I didn't know you all didn't know about Narcan. So Narcan is a reversal agent to reverse an overdose. So it works really, really quickly. So one thing that I do with every prescription opioid that I write, whether it's oxycodone, Narcan, oxycodone, Norco, I make sure people get Narcan. So it's a reversal agent. When I'm in the community working, I make sure I give those out as well, because that's actually what saved lives. So the other thing too, in our community, I did a few focus groups, St. Louis City and St. Louis County. And what I heard from a lot of, Black active substance users, to reverse an overdose, we've learned to create our own ways. I heard things from, injecting your veins with salt water, or using mustard up somebody's nose and mouth to reverse an overdose, or putting them in a bathtub of cold water and ice. So people have tried to learn how to respond to an overdose to save somebody's life. And so Narcan, there's 3 different type of modalities to use it, but the main one we use is almost like Flonase. If you ever used a nasal spray before, you squirt it up the person's nose, before the pandemic, so you can give CPR breaths to breathe for the person to keep them alive. But it actually works really, really quickly. And what it does, once you squirt up the nose, it immediately removes the opioid off the receptor in your brain and reverse an overdose. So that's another thing that's really important, making sure we have access to that to people in our communities. And so a lot of work was done too with passing out Narcan, teaching people how to use it, because it's a life-saving medication.
So look, like in the bottom, like Lily asked, is it like an EpiPen?
You don't inject it like an EpiPen, but the idea is like an EpiPen. If somebody's having an anaphylactic reaction, you will inject the EpiPen to reverse the anaphylaxis, right? But this one you can squirt up the nose to reverse an overdose. So same concept, just is not anything to inject. They do have some injectable ones, the intramuscular, where you can draw it up and you can put it into the person's arm. But we use that one as well as the one that you can spray in the nose to reverse an overdose.
So somebody was at a cookout one day and somebody had an overdose. Somebody said, "Grab that mustard and put it up their nose." And
yeah, this was actually.
I'm trying to see how that happened.
I know.
No.
I didn't know either. He hit me to something, because he was an older Black guy, and he was, when I was talking to him about Narcan, pretty much I was talking to a group of Black people who were using, just trying to educate myself, but also create some messaging that that resonated with. I didn't want to create whitewash type messaging. And he was telling me about back then, and even, he's still actively used. He's like, this is what we had to do. We had to learn how to survive. But I'm like, mustard.
You know what? Hey, but with that being said, though,
it's always been that way.
But look, with that being said, though, we have to remember innovation. Look, when people want something, they go find some crazy ways to get it in. And if you like to use, you don't, like you said earlier, you don't want to die from it. So you go try. Hold on, let me grab this and see.
Right, let me see.
You know what I'm talking about? You go try to do something. So when individuals getting it in, I can see that. But yeah, at the barbecue, past the mustard, because
I don't know the mechanism behind how it works, but he told me, he was adamant that he said they keep some mustard in the refrigerator. If that happened, they open the person's mouth, pour it down their mouth and their nose. He said it worked.
Hey,
I'm not gonna knock an old 50-year-old. Like he knew what he was talking about.
Look, if he's still using, still around, sometimes he ain't the dumbest thing. You know what I'm talking about? But listen, we want to open up the lines, y'all. If y'all want to call in and even just give her roses, right, for help giving us this education. I feel like every time I talk to you, like I didn't been to school. All right, I like school, but it's like I've been to school again. You know what I'm talking about? I'm learning so much, but we can take this information and help share it. Hopefully, individuals are doing that and willing to do that. You know what I'm talking about? But no, thank you, seriously. Sure.
Hey, Dr. Turner, I want to say kudos to you first off for going out in the community and having these conversations, because if you don't get out in the front and learn these things, you'll never know if you're sitting in your office, in the hospital, or the clinic, or wherever you work, right? So you're out there having these conversations. You're like, wait a minute, you don't need to use the mustard. I got this for you. And they're like, okay, right. They don't have that access. So that's like, I have to commend you, because you would never know that if you're not out there, is what I'm saying. You're not working from a laboratory. You're out there and you're getting this information up front and you're like passing it on. But where I want to go to is for us, because I'm telling you, I'm green when it comes to all these new drugs. I can't keep up. Unless I hear it in a rap song, I'll be like, what is that? I don't even know what the hell they're talking about nowadays. But can you talk about, I know fentanyl's the big wave right now, but is there something we need to be on the lookout that's brewing right now that's probably going to be the next wave to come that you can educate us on?
So you still have, the fentanyl. There's different, we call fentanyl analogs. People kind of get the basis fentanyl, they're kind of mixing other stuff in there. The next one, carfentanil, is elephant tranquilizer. It's like 10,000 times more potent than morphine. So there are certain areas across the country in which you can see carfentanil, which is really, really potent. Matter of fact, do you all remember, I think it was like a year or two ago, a club in East St. Louis, and I think it was like a stripper or somebody that overdosed. Anyways, it was carfentanil. It only takes a little bit.
I think I heard.
I think it was like a few years ago. I don't remember which strip club it was, but I know it was in East St. Louis. And it was carfentanil, which is the elephant tranquilizer.
Why? Why? Hold on. Why?
Some little ass stripper decided to take elephant tranquilizer. I'm not. But
but it's in other parts of the country, so I can't really, but the idea is people think that it's more potent, and that's why I try to, more potent doesn't mean a stronger or a higher high. You increase your risk of an overdose. And so that's where some of the education come from. Now I will say you see more people have beans or pies, it's more so mixed. So you'll see cocaine. So cocaine is definitely on the rise again in the Black community, in addition to opioids. I've also seen some meth as well. So the stimulants are actually on the rise now. So there's your methamphetamine, your cocaine. So you see that kind of going up too, in addition to the opioids.
So what about the age range? So so we got this question down here. Is there anything specific to teens or young adults? Like, what's a new party?
The vaping
drug.
And if with the vaping, with the e-cigarette, that's like nicotine and other harmful substances. Unfortunately, I mean, you see it across the board. I mean, 18-year-olds, here in St. Louis, our peak was, 35 to 55. That was the peak overdose deaths. But then, we're seeing also with 20-year-olds. I think the biggest thing, like I said, I don't like those fear motivated type talks when it comes to substance use. I think, if you're going to talk to your child about this, like, be upfront, like, don't try to water this down. Don't try to, make this all fearful, because once they go to school or if they get exposed to it, you want your child to know. It's like my daughter, I used to have her actually when I was doing presentations, or I used to have her go with me, or either, when I'm putting my presentations together, I used it as an opportunity to talk to her, let's have an actual conversation about this, so if it comes up, you're going to know, if you hear these terms on the playground. So for me, like, that's my perspective, but it's the same way. I think because I'm just a doctor, but even when it comes to sex, when I talk to her about that, I want her to be well-informed. I want her to be educated. I don't want anybody to slip her anything. Like, no, these are conversations I had with my mama, and I like to keep that door open to talk to my daughter.
Dope. All right. We'll wrap it on up. Herm, what you got?
Say, Doc, again, really appreciate you for coming in and talking to us. I knew Larry was old when he talked about lean, because I don't think nobody's doing lean no more. But I was
like, lean. I was like, codeine. I was like, you know what? I'm like, I can talk about codeine.
I mean, they call it codeine. It's still the same crap. When it's all said and done with the double red cups, y'all know what's in it, right? So
I almost threw on my 1990s Big T and Big Jeans on when I heard him say that.
It's the same thing, but it's still the same effects. They just call it something totally different.
Hey, but on a real, I'm just as lost as Larry when it comes to this. So this show really did open my. I didn't even know what fentanyl was until you started mentioning it, and I would have never thought people was taking elephant tranquilizers. You know what I'm saying? I was like, what happened to regular weed? You know what I mean? What is that? That's not cool no more.
I mean,
you know what I mean? Like,
you're trying to get, like, how high?
What happened to Puff Pass? I mean, that used to be good enough. You know what I mean? But
is there such thing as
no, dog. That thing dropped the elephant. I got to get on that. I mean, I don't. You know what I'm saying? So, Doc, thank you for all you're doing in the community. You know what I'm saying? Saving people from elephant tranquilizers. Really appreciate that. You know what I mean?
Is that the only thing you heard this whole time?
No, I know you could put mustard in your nose too and save somebody's life. You know what I'm saying?
And you know how to usher people into a nice, clean trap house. It's good. It's all good.
And then I call it church. He call it trap house. I call it church. You know what I mean? But
anybody who just joined, safe consumption sites. That's for anybody who just joined.
But on the real, all jokes aside, I got the utmost respect for you. You know what I mean? Because you took this as a personal mission. You saw something that need correcting, and instead of, you know what I'm saying, just feeding into the narrative, you stepped in and, you know what I'm saying, to start changing the narrative. We've been so used to things in the past being said, you know what I'm saying, the wrong way, and really not trying to help our own people. You know what I'm saying? So it's good to hear that now the narrative is changing. And we're actually trying to bring them up instead of keeping them down. So thank you for what you're doing.
Yes, ma'am. Yes. And ma'am, do you have any last message for our audience?
No messages. I'm glad everyone listened to this. I think it's important information, and let's start with changing the narrative ourselves so we can stop calling people drug addicts, stop saying crack house. Crack cocaine babies. Let's change our language.
Right. And and you're absolutely right, but it's unfortunate. Even what is it, 2021? People still getting hooked on crack. How does that happen? You dig? How? But whatever. Hey, teach his own. But listen, shout out to you. Shout out to everyone that's watching and that have stuck around. We love y'all. Seriously. Oh, go ahead, Larry. What you got, brother?
Yeah. Shout out to Will, because I know he was in the comments, even though he can't be on the show. You know,
Yes.
everybody knows he's deployed right now, but shout out to him. He connected us with the good old doctor, and we appreciate
Yeah,
everything
thank you,
that he brought
Will. Thank
to the
you.
show. Absolutely. Foots running the comments, shout out to him. But like I said, I wanted to just go back and thank you for being out up front, educating us. Like I'm telling you, this means so much that you probably don't even realize. And then later on down the line, hopefully you're getting some more to help take over with you. Like, I just appreciate you, what you bring. Thank you for the education. And hopefully you come back on here a third time. Like, I need a part 3 now.
Hey, so look, yeah. So with that being said, though, but ladies and gentlemen, y'all make sure that y'all share this, and stay connected. You know what I mean? And look, if you know someone that's going through this situation right now, tell them you love them anyway. Right on. And so we're gonna leave it with that. We will see y'all soon. All right, y'all be easy. 1.